Hi, I'm Rick High, firefighter EMS clinician from Howard County Fire and Rescue. High-performance CPR has been shown to improve survival from out-of-hospital cardiac arrest and for this reason has been included in the Maryland medical protocols for many years. In the 2025 protocols, we have streamlined the procedure into algorithm form and included the new algorithm in the adult cardiac arrest section. You will find that the adult algorithm closely mirrors the pediatric high-performance CPR algorithm that we introduced in 2024. As always, begin with a quick patient assessment, checking for responsiveness, breathing, and a pulse. This should take no longer than 10 seconds. High-performance CPR should begin immediately upon confirmation that the patient is unresponsive, apneic, and pulseless. Remember that except under extenuating circumstances, you should stay on scene during the initial resuscitation. As we move down the algorithm, you can see that the first clinician begins resuscitation with continuous chest compressions at a rate of 100 to 120 compressions per minute. Clinician number one should also call for the AED or defibrillator if it is not already at the patient's side. Clinician number two attaches the defibrillator and then begins to provide ventilations. Ventilation should be delivered during recoil, that is, the upstroke of the compression, at a rate of one breath every 10 compressions. This clinician should also place an airway adjunct and suction as needed. Note that once an advanced airway is in place, the ventilation rate changes to one ventilation every 6 seconds. These breaths are delivered asynchronously with uninterrupted chest compressions. At this point, high-performance CPR continues in 2-minute cycles. Pauses every 2 minutes should last no more than 10 seconds. Coordinated activities during these pauses include pulse checks, rhythm check and or AED analysis, shock if indicated, and changing compressors. When more than 2 clinicians are available, additional tasks for ALS clinicians include establishing IV or IO access, administering medications, and establishing an ALS airway. Tasks that may be assigned to either ALS or BLS clinicians include assuming the coach or timekeeper role and providing family support. Essentials of high-performance CPR to keep in mind at all times include maintain a compression rate of 100 to 120 compressions per minute. Proper compression depth is 2 inches. Minimize interruptions. Pauses should last no longer than 10 seconds. Ensure full chest recoil. Coordinate 2-minute cycles and rotate compressors every 2 minutes. The team approach of high-performance CPR has been shown to ensure effective and efficient use of EMS resources in the treatment of cardiac arrest. Through this systematic approach, the Maryland EMS system continues to improve survival rates. In 2024, our system saved the lives of 422 patients in cardiac arrest and sent them home with a favorable neurological outcome. With your continued dedication to high-performance CPR, we will continue to have a tremendous impact in the lives of hundreds of patients in Maryland each year. You are dispatched for an unresponsive 50-year-old male patient. Dispatch advises that adequate breathing has not been confirmed. When you arrive on scene, your partner gathers equipment, including the AED, while you go immediately to the patient's side. Your first step on approaching the patient is A, call for the stretcher and begin packaging the patient for transport. B, begin CPR with continuous compressions. C, assess the patient for responsiveness, breathing, and a pulse. Or D, begin ventilations at a rate of one breath every 5 seconds. The correct answer is C, assess the patient for responsiveness, breathing, and a pulse. You have begun high-performance CPR with continuous compressions. Your partner's tasks include A, attaching the defibrillator, B, providing ventilations at a rate of one breath every 10 compressions, C, providing family support, or D, both A and B. The correct answer is D, both A and B, attaching the defibrillator and providing ventilations at a rate of one breath every 10 compressions. Essentials of high-performance CPR include A, minimizing interruptions in compressions, B, compression rate of 100 to 120 compressions per minute, C, rotate compressors every 2 minutes, or D, all of the above. The correct answer is D, all of the above. Minimizing interruptions in compressions, compression rate of 100 to 120 compressions per minute, and rotating compressors every 2 minutes.